welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Cannabidiol can be used as analgesic for pain treatment. Cannabidiol is effective in improving immediate post-operative pain following arthroscopic rotator cuff repair, according to research presented at the American Orthopedic Society of Sports Medicine 2022 annual meeting. Cannabidiol could be safe and effective as a pain medicine for patients after rotator cuff surgery, suggested researchers in a multi-center, placebo-controlled, randomized, double-blinded trial conducted on patients undergoing rotator cuff repair. The study enrolled 80 patients from 18 to 75 years of age, and one group received 25 mg of cannabidiol TID if patients weighed less than 176 pounds or 80 kgs and 50 mg of cannabidiol if they weighed more than 176 pounds or 80 kg for 14 days, and the control group was given a placebo. Currently, cannabidiol is FDA approved for the treatment of some seizures, and other studies have suggested the therapy may help treat anxiety, cognition and movement disorders. Research is yet to prove that it can be used to treat these disorders. Patients were followed up on days 1, 2, 7 and 14, and the visual analog scale, that is VAS, for pain, opioid consumption and satisfaction with pain control were recorded. The VAS is a validated subjective measure for acute and chronic pain. Scores are recorded by making a handwritten mark on a 10-centimeter line that represents a continuum between no pain and worse pain. Additionally, liver function tests or LFT were done on days 7 and 14 to assess safety, and nausea was monitored. Based on the findings, CBD is safe and effective in reducing pain in the immediate perioperative period following rotator cuff repair and should be considered in post-operative multimodal pain control, the researchers concluded. How lifestyle can impact. Individuals with no dementia risk factors such as smoking, diabetes or hearing loss have similar brain health as people who are 10 to 20 years younger than them, according to the new Baker study. The study found that a single dementia risk factor could reduce cognition by the equivalent of up to 3 years of aging. The study, published in the Journal of Alzheimer's and Dementia, Diagnosis, Assessment and Disease Monitoring, a journal of the Alzheimer's Association, included data from 22,117 people aged 18 to 89 who completed the Cognicity Brain Health Assessment developed by Bakerest. Participants took the test in their own homes by going to the Cognicity website. The test takes around 20 minutes to complete and consists of a background questionnaire and 4 cognitive tasks. The researchers looked at participants' performance on memory and attention tests and how this was impacted by 8 modifiable risk factors for dementia, that is low education, that is less than a high school diploma, hearing loss, traumatic brain injury, alcohol or substance abuse, hypertension, smoking, currently or in the past 4 years, diabetes and depression. Each factor led to a decrease in cognitive performance by as much as 3 years of aging, with each additional factor contributing to the same amount of decline. For example, having 3 risk factors could lead to a decrease in cognitive performance equivalent to as much as 9 years of aging. The effects of the risk factors increased with age, as did the number of risk factors people had. Researchers said that, in all, their research showed that we have the power to decrease our risk of cognitive decline and dementia. We can start by addressing any risk factors that we have now, whether we are 18 or 90, and we'll support our brain health to help ourselves age fearlessly. The rare condition of hidden consciousness in brain. A new study finds that signs of covert consciousness, subtle brain waves detectable with EEG, are the strongest predictor of eventual recovery from brain-injured patients who otherwise appeared completely unresponsive. The findings suggest brainwave analysis has the potential to completely change how unresponsive patients with acute brain injury are managed. The study was published online in Lancet Neurology. Standard bedside assessments alone do not always predict clinical outcomes. In the intensive care unit, doctors routinely assess the prognosis of brain-injured patients by asking them to respond to a simple verbal command such as move your hand or stick out your tongue. Those who do not respond to these commands are thought to be unconscious. In the absence of any other explanations for this unresponsiveness, injuries may be considered so severe that patients are unlikely to regain consciousness. Researchers found that covert consciousness is an independent predictor of recovery, stronger than any other established factor they looked at, including the patient's age, initial Glasgow Coma Scale score, that is a standard measure of the extent of neurological injury or the cause of the brain injury. In the future, cognitive motor dissociation may be another factor to consider when assessing a patient's prognosis. The researchers are investigating the underlying mechanisms of covert consciousness to better understand why a patient who has brainwave activity in response to different motor commands and is not paralyzed cannot physically act on these commands. They also are interested in studying how degree of covert consciousness are linked to clinical outcomes. Researchers concluded that in some rare cases, unresponsive patients do eventually regain consciousness and may make meaningful progress toward recovering many day-to-day functions many months later. How negative insults can trigger a mini slap to the face. The exact way in which words can deliver their offensive, emotionally negative payload at the moment these words are being read or heard is not yet well understood, said corresponding author Dr. Maren Struiksma of Utrecht University. Because insults pose a threat against our reputation and against ourselves, they provide a unique opportunity to research the interface between language and emotion. The author continued, understanding what an insulting expression does to people as it unfolds and why is of considerable importance to psycholinguists interested in how language moves people, but also to others who wish to understand the details of social behavior. Electroencephalogram and skin conductance electrodes were applied to 79 female participants. They then read a series of repeated statements that realized 3 different speech acts. Insults, for example, Linda is horrible. Compliments, for example, Linda is impressive. And neutral, factually correct descriptive statements, for example, Linda is Dutch. To examine whether the impact of the words depended on who the statement was about, half of 3 sets of statements used 2 participants' own name and the other half used somebody else's. The experiment involved no real interaction between the participants and another human. The participants were told that the statements were being said by 3 different men. The researchers found that even under unnatural conditions, that is a lab setting, no real human interactions and statements coming from fictitious people, verbal insults can still get at you, no matter who the insult is about, and continue to do so even after repetition. Specifically, the EEG showed an early insult effect in P2 amplitude that was very robust over repetition and did not depend on who the insult was about. P2 is a waveform component of the event-related potential or ERP measured at the human scalp. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.